This segment of DelmarvaLife is sponsored by TidalHealth.
Well, we all know we should talk about our heart, but what about our brain? The past couple of weeks, we have talked about strokes, how to recognize the warning signs, and why getting treatment quickly can make all the difference.
And today we're continuing that conversation by taking a broader look at brain health. Dr. Stephen Falchek is a neurology practitioner at TidalHealth. He joins us to explain why neurology plays such an important role in stroke care and how a new local residency program could help strengthen neurological care here on Delmarva. So welcome.
Yeah. Welcome.
Thank you so much.
So in regular person terms, can you explain to us what a neurologist does?
So what a neurologist does is to analyze where along a certain chain or pathway a problem might lie. That pathway lies from the brain to the brainstem to the spinal cord to the peripheral nerves to the muscles and end organs. And then upon learning where that problem might lie, trying to determine what the best approach is. And a neurologist will specialize in identifying the treatments that are currently available for problems that lie along that pathway.
So what are the most common neurological conditions you see in patients today?
So it depends upon the age group, but certainly stroke is very high on the list right now. As stroke as well as Alzheimer's disease and other causes of dementia, and then also epilepsy. I myself am an epileptologist, so I specialize in the treatment of epilepsy.
So a lot of concern about strokes these days, and we could never repeat it enough. What are some of the symptoms that people really should be aware of?
So there's an acronym FAST, which is face, arm, speech, time to call. So with that, you know, almost any sort of alteration in functioning can be potentially a sign of stroke, but the things that are most common are a facial droop or inability to move one side of the face suddenly, weakness of the arm, and slurred speech, difficulty speaking, or a total loss of speech. Total loss of consciousness can happen with a stroke, but isn't the most common presentation. It's usually more these lateralized, in other words, one-sided symptoms.
Now, brain health it seems to be a hot topic these days. What would you say are the best ways that people can protect their brain no matter how old they are or how young they are, really?
Okay. So as an aside, I'm a pediatric neurologist as well as a neurologist, so I'm used to dealing with across the brain spectrum. My answer to that is the Greeks had it right when they said, you know, or the Romans, I guess, mens sana in corpore sano, a sound mind and a sound body. So you are one integrated whole, and all your organ systems are interconnected intimately. The things that you do to preserve your general health will also help preserve your brain health. So exercise and diet are the most common things, but it's also attitude, engagement, all of the things that sort of we normally think of as being associated with a healthy and productive life. So it's not only exercising regularly and eating well, trying to avoid excesses of almost anything, really. You know, we don't want you to sort of think that you have to be on this strict, almost monastic diet, but you have to sort of pay attention to really what is healthy and really what's proportionate. But then also being engaged, being socially interactive, finding a hobby, finding things that give you joy in life, taking time and visiting your relatives or visiting your friends, even if it's a little bit of a distance or a little bit of a hardship. Those sorts of things keep us engaged, keep us focused, and they benefit the health of our entire system. I know that sounds a little smoke and mirrors or, you know, new age, but it isn't. This is provably true time and time again in research studies that all of these things that contribute to quality of life in fact help preserve our overall health and our longevity.
Makes sense. Absolutely.
So you're involved with the neurology residency. Can you explain why that's important for the community?
Yes, so I'm a residency program director. So a residency is your future of your healthcare. This is where the individuals come at a young age to learn how to help take care of the rest of us, myself included, down the road. And also our children, if they're training in pediatrics or pediatric neurology. This is a gift that keeps giving in a community. When you have people who train in a region, they tend to identify with the people there, and even if they don't stay there to practice, those connections also pay dividends down the road because people at least know to refer or know what sort of systems they need to operate in if they have patients coming from a certain area. But the idea is ultimately to train people who have some interest in actually staying in an area and becoming part of the community.
And they are more than welcome here. Dr. Stephen Falchek, thank you so much with TidalHealth Neurology, and interesting information. Thank you.
Thank you.